Hello everyone, good afternoon. My name is Irene from Infection Control Department. Would like to welcome you on my live stream. Topic today for is about Antimicrobial Stewardship Program and Antibiogram. And with me today, the guest participant for today is our Dr. Sana from Head of the Laboratory. I will start first for the presentations of my antimicrobial stewardship program. First, let's start. I will present this to you today. Okay, let's start. Let's start for our definitions. This arrow means continuous for core elements, your purpose, the roles of the team, indicators, and PDCA project. And what is PDCA? This is your plan, do, check, and up from an improvement project. Next, your antibiotic stewardship program. The definitions. Okay, this is a coordinated program that promotes the appropriate use of antimicrobials, including antibiotics, improves patients' outcomes, reduces microbial resistance, and decrease spread of infections caused by MDRO, MIDRO, which are multi-drug resistant organism. We did this topic on the last 3 weeks. And by the way, I did not came out since I did not do my lecture, I think 3 weeks because I'm preparing my review for my international, for my board exam for infection control. And also I have some survey visits. That's why I did not have a lecture. But now I'm here again. Welcome back to my live stream discussion for today. The program is based on, to be continued for our definition, the program is based on scientific evidence, accepted practice guidelines, and local laws and, of course, regulations. These are our core elements, including your leadership commitment, dedicating necessary resources, accountability, appointing a single leader responsible for program outcomes, actions, implementing actions to achieve the goals, the tracking of indicators measuring compliance with the program. And one example of this that I have is my KPI indicators. And these indicators do it by quarterly. So every 3 months. So how many you will do in 1 year? You must have four. And reporting of informations on antibiotic use and resistance to doctors, nurses, and relevant staff. Education, educating clinicians about resistance and optimal prescribing. And of course, we need to have a goal. Our purpose is to reduce antibiotic consumptions, and inappropriate use. Reduce Clostridium difficile infections to improve patient outcomes, and increase adherence utilizations of treatment guidelines, and reduce adverse drug events, and decrease or limit antibiotic resistance. I will check first. Okay, the next is your antibiotic stewardship driver diagram. Is the next one. Okay, sorry for the interruption. Use timely and appropriate antibiotic utilization in the acute care setting, and decrease the incidence of antibiotic related adverse drug events, the ADE. Decrease prevalence of antibiotic resistant healthcare associated pathogens. Decrease the incidence of healthcare associated difficile infection, and decrease pharmacy cost of antibiotics. And that's it. Timely and appropriate antibiotic utilization in the acute care setting, like us. Timely and appropriate initiation of antibiotics. Promptly identify patients who require antibiotics. Identify patient. How will you identify? By a surname, he or she, a surname, and then by see name, patient name tag. Or how about if the patient cannot talk or he has a problem? You should rely on significant others that they call their family members. Okay, obtain cultures prior to starting antibiotics. It was said obtain cultures prior to starting antibiotics. Do not give antibiotics with overlapping activity or combination not supported by evidence or guidelines. Determine and verify antibiotic allergies and tailor therapy accordingly. Antibiotic allergies, that's why we have skin test for some antibiotics which were given. Consider local antibiotic susceptibility patterns in selecting therapy. Then start treatment promptly. Specify expected duration of therapy based on evidence and national and hospital guidelines. Timely and appropriate antibiotics utilization is the acute care setting. Appropriate administrations and de-escalation. Make antibiotics patients is receiving and start dates visible to a point of care. Example of this, like if you are the patient is in the ward or if the patient is in the ICU. Give antibiotics at the right dose and interval. Yes. Stop or de-escalate therapy promptly based on the culture and sensitivity results. Reconcile and adjust antibiotics at all transitions and changes in patient's condition. Monitor for toxicity, reliability, and adjust agent and close dose promptly. Timely and appropriate antibiotics utilization in the acute care setting. Data monitoring, transparency, and stewardship infrastructure. You need to monitor the feedback and make visible data regarding antibiotic utilization. Antibiotic resistance, ADE, what's that? Adverse event reactions, CDFCD and cost and adherence to the organization's recommended culturing prescribing practices. Next, team members. The team members must include, of course, physician, the pharmacist, supervisor, the microbiologist, the infection control physicians, the PI physician, and the administration representative. General rules of antimicrobial stewardship team. Chief Medical Officer, ensuring antimicrobial stewardship becomes strategic goal of the organization. Communicating on why change is needed to staff and other leaders of departments. Reviewing progress by the team, identifying barriers, and providing advice. Then participate endorsing the EMS team and the activities. In team leader, uh, a senior physician deemed to the suitable by CMO. Represent the AMS, the antimicrobial team, in the hospital infection control committee and gives feedback to AMS program. who opted into the drugs and the therapeutics committee when considering changes of antimicrobials in the hospital formulary, prepare surveillance and audit reports for submissions to pharmacy and therapeutic committee. What does it mean? Uh, this surveillance, this is include your MDRO, multi-drug resistant organisms. That we discussed this already since I think a month ago with the team of head nurses from the ICU and from the OR. This is the general rules of antimicrobial stewardship team. Again, general rules of antimicrobial stewardship team. Team antimicrobial pharmacies ensures dose optimization is carried out, especially for complex antimicrobials and complex clinical scenarios. Enforces the approval system of restricted antimicrobials. Ensures safe and effective use of medications to reduce risk for errors and adverse events. Medication errors. Then your surveillance of antimicrobial use and also the analysis of local consumptions and expenditure. General rules of antimicrobial stewardship team. Clinical microbiologists. Provision of guidance on appropriate diagnostic tests in microbiology. The provision of timely and accurate reporting in culture and antimicrobial susceptibility data. You should ensure the selective reporting of antimicrobial susceptibilities and interpretive reporting of what your microbiology results. That's why on this program, antimicrobial, it's important your collaboration, cooperation, teamwork in the where laboratory department. Ensure the appropriateness of microbiology requests, sample collections, types, time, date, taken, and documentation. Documentations is a must. You cannot, without documentation, you will be lost. It's important anyway. And sample quality. Work closely with the attending clinician, infection specialist, and then antimicrobial pharmacist in the management of patients with infections. Yeah, physician. PCI physicians leads the technical component of antimicrobial stewardship team. Consult and advises on specific stewardships related cases and issues. Provision of antimicrobial resistance patterns data. What is that? Antibiogram. And this antibiogram will be followed after my presentation with my head of the laboratory, Dr. Asana. She will be the next after me. So you will inform me regarding antibiogram, the latest update about the antibiogram. It depends, but for us, it must be backdated 6 months. We do it 6 months backdated. Now we are already have the report for the last because when we have a survey the last time, uh, they ask, even me, they asked me how you do your antibiogram. What is the antibiogram in your facility? P70 or biannually basis. See, biannually means every 6 months. 6 months. Next, what can doctors do? Antibiotic resistance happens when bacteria change and because resistant to antibiotics used to treat the infection they cause. This is the first. I will make compromising our ability to treat infectious diseases and too many advances in medicine. We must handle antibiotics with what? Of course, with care. Like ourselves to remain effective for as long as possible. Okay. Do you always follow infection prevention and control protocols? These are the questions. We use diagnostic to make informed treatment decisions when possible. Do you only prescribe dispense antibiotics when they are needed according to current guidelines? Do you talk to the patients about how to take antibiotics correctly? Antibiotic resistance and the dangers of misuse. Do you talk to patients about preventing infections such as vaccinations, hand washing, covering nose and mouth when sneezing? And another, what can pharmacists do? Okay, antibiotic resistance happen when bacteria change and because resistant to the antibiotics used to treat the infections they cause. This is compromising our ability to treat infectious disease and undermining many advances in medicines. Same. What can pharmacists do? Do you only dispense antibiotics when they are needed according to variant guidelines? Does the patient have a valid prescription? Is it for right drug, dose, and duration? When a patients are seeking treatment for cold or flu, do you explain that antibiotics are not needed? Do you talk to patients about how to take antibiotics correctly? Antibiotic resistance, the dangers of misuse. Do you remind patients to contact their health professionals? If symptoms persist, do you talk to patients about preventing infections, vaccination, hand washing, safe sex, covering nose and mouth, and sneezing? Next slides. Nurses. What can nurses do? It's the way what I mentioned, they are all the same anyway. These are for pharmacy, not for doctors, pharmacy and nurses. General rules of antimicrobial stewardship team. Education. This must be continuous nurse education, continuous medical education, antimicrobial newsletter including subtopic on antimicrobials in hospital publications, educational aids to guide prescribers at the point of prescribing. This might include uh, clinical algorithms for the diagnosis, the indicators, adherence to documentation policy at time of antimicrobial initiations. What is that? Your dose, durations, and indication. Appropriate empirical prescription according to guideline. Preoperative, prophylactic, antibiotics within 60 minutes before surgery. And we have checklists for this. Excuse. Uh, in our SSI, surveillance and surgical site infections, this included 60 minutes before surgery prophylactic antibiotics. It was there. It was us in the tabulation for our nurses. In this applicable where in the or antibiotic de-escalation within 24 hours after surgery. Okay. Use of prophylactic, timing and use of prophylactic antibiotics. Timing and use of prophylactic antibiotics. The definition: percent of surgeries cases that receive prophylactic antibiotics within 60 minutes. The target code is 95. This is the sample. And then the dimension is your safety, timing, appropriateness. Your measurements, your process. In these tabulations, as you can see, 1, 2, 3, 4, 5, 6. This is counted as quarterly. So 2, 3, 4. 2, 3, 4 means, and then first, second, third means you are in the third quarter of the year. What's this? January, February, March, April, May, June, July, August, September. So September. Now is October. It's my birth month. Happy birthday to me. Anyway, October is the third month. October, November, December, the last. Okay. This is our accreditation body. The SIBAHI. We are already accredited. And then the next one is the GCI. And the other one is the quality. Okay. This is tabulation for all the job title that included in the team. Medical Director, the Internal Medicine, the Project Improvement, Head of Microbiology, the Infection Control, the Inpatient Pharmacy, and the Nursing Services, and the Nursing Educator. The PDCA report must be approved start from January, and then the project team composition is then approval for the February 2nd week. And you should pass the first meeting for the month of February. Thank you. Now, for the continuous discussion, I would like to welcome Dr. Sana for the next presentation. I would like to welcome our head of the laboratory director. Laboratory directors are for waiting. Dr. Sana on the screen.
Can
Good
you
afternoon,
hear
Doctora.
me? Hear me? Erlene,
Yes,
good
Doctora, I can
afternoon.
hear you. How are you, Doctora?
Can you hear me well?
Yes, I can hear you well. Now, we
Okay.
will start to discuss our antibiogram for the continuation of our topic discussion for the day that we would like to inform our staff. They can also join your laboratory staff, because the link I provide on the.
Okay. Good
Okay.
afternoon for everybody. Thank you, Erlene, to give me this chance to talk about antibiogram.
Mhm.
I will talk about antibiogram, the objectives of this lecture, definition of antibiogram first. Erlene, can you share or capitalize
It's already, you see?
the slides?
I'm already
Full
starting,
screen.
Doctor.
Can
Yeah,
you full screen the slides?
it's already full screen.
Yes, to be more clear.
Yes. Now it's a full screen. You see?
No, not full
Okay,
screen.
okay. 1 minute, Doctor.
Yes, click the cup under the slide,
Okay. No problem, Doctor.
PowerPoint.
Coming out. Just a minute. And this is it, Doctora. You see it?
Click the cup, yeah, Erlene. Click the cup.
It's okay na, Doctora. Start na.
Lower the slide. There is a cup. Clear this cup to full screen the PowerPoint.
Not clear?
Yes. Before
It's okay
this,
na?
before this, before this, it is okay. Before this.
Okay.
Clear the cup to full screen.
Doctora, I will check.
Open again.
Yes. Is it? This is full screen na, Doctora. Yeah, this up. Good. Fine na,
Not
Doctora.
full, not full screen. This is a slide, not full screen. Okay, I will begin, inshallah.
Yes.
Definition of antibiogram. Then I will talk about the uses of antibiogram, mechanism in testing the antibiogram, interpreting the antibiogram, documenting the antibiogram. Then finally, I will talk about the future of antibiogram, how will be used in the future. Okay, next. What is the antibiogram? Definition of antibiogram is a laboratory test used to determine the sensitivity pattern of given microorganism to a large of antibiotic. In the lab, we make isolation of the bacteria, then make sensitivity to the bacteria to know the sensitivity of each antibiotic and what is the antibiotic is intermediate and what is the antibiotic that is resistant for antibiotic. Antibiogram also mean it is a method of testing the efficacy of antibiotics by introducing an antibiotic into the middle of a bacteria, leading petri dishes, a clear zone. See here, uh, Erlene, next slide. Click next slide.
This.
In the next slide. In the means of antibiogram slide.
Okay.
Means of antibiogram slide. I'm here.
Yes. This one.
I'm not in the objectives. This appear to me objectives slide. Erlene, click next slide,
This one.
please. Can be out and return back if your computer not responds.
Oh, maybe it's okay, Doctor. You need to repeat, huh?
Okay, no problem. Can be shut down and open again.
Doctor, I will see. Okay. We'll check. What number of slides use?
It also means of antibiogram.
This one?
After next, yes,
Next?
I'm here.
This one?
Yes, capitalize the picture or make full screen. Click the cup.
Yeah.
Under
This,
the
this
the
is
screen.
Doctora.
There
This
is a
is
cup.
full screen.
Yes.
This is full screen. You see? It's already full
Okay.
screen. 100%.
طيب, it also means a method of testing the efficacy of antibiotic by introducing an antibiotic into the middle of a bacteria. Latin Petri dishes. This is the picture of the dishes. We see in these pictures the disc of antibiotic. The largest one, this is the more sensitive antibiotic, and the smallest one, it is the resistant or less sensitive antibiotic to
So
the
the
identified
smallest
bacteria.
one.
A-
Yeah.
yes,
The
a
one you
clear
mentioned is
zone
the small.
indicates yes, a clear zone indicates the bactericidal activity. The greater the diameter of the zone, the higher the efficacy of the antibiotic. The more efficient antibiotic is the largest one that has the largest zone. This is the more efficient antibiotic. Clear?
Yes,
طيب,
clear.
what is a hospital antibiogram? The hospital antibiogram is a periodic summary of antimicrobial susceptibility of local bacterial isolates submitted to the hospital's clinical microbiology laboratory. In the Zafir Hospital, we make the antibiogram periodically, annually. In 2020, we made the antibiogram in 2020. Then, inshallah, we'll make the next antibiogram in a Zafir Hospital in December, inshallah. After finished December, we'll make, inshallah, 2021 antibiogram. Annually, maybe annually. Antibiogram are often used by clinicians to assess local susceptibility rates as an aid in selecting empiric antibiotic therapy and in monitoring resistance trends over time within an institution. نحن بنعمل الانتيبيوجرام عشان نتابع ما هي الانتيبيوتيك اللي هي الريسيستنت بقت مقاومه للانتيبيوتيك، ولا عايزين نعرف برضه نتابع الثيرابي التريتمنت بتاع البيشنت هو ريسبونس للانتيبيوتيك اور نوت. Why we need an antibiogram? Antimicrobial resistant bacterial infection are challenging problem in the hospital setting. Infections caused by resistant and multi-drug resistant bacteria not only increase morbidity and mortality, but also increase overall health care cost. هي ما فقط بتأثر على الإمراضية وزيادة معدل مثلا الوفيات في المستشفيات لما تكون البكتيريا مقاومة للأنتيبيوتيك، هي برضه بتأثر لي على الكوست الإيكونوميك ستيتس، بتأثر على الإيكونوميك primarily by prolonging hospital lengths of stay. البيشن حيقعد لنا مدة أطول في in the hospital إذا كان هو ما قدر ما حصل له response to the شنو الأنتيبيوتيك. Hospital-associated infection can be monitored with antibiogram in situation when hospital-acquired infection do occur. The preponderance of MDR, multi-drug resistant bacteria as the causative pathogen challenge clinician in selecting appropriate therapy and treatment regimens. نحن عايزين نختار select the appropriate antibiotic عشان شنو to avoid the فيما بعد يجينا شنو يحصل لنا mutation للبكتيريا. As you mentioned, Erlene, if not use the patient antibiotic well, it may be cause this lead to a mutation of the bacteria, and this mutation muted bacteria must be or will be resistant to the specific antibiotic. We need better mention to monitor antibiotic therapy. Inappropriate therapy can have significant clinical and economic consequences. بتأثر لنا على الكلينيكال وبتأثر لنا على الايكونوميك if the antibiotic oral therapy can inappropriate. Antibiogram add to multi-drug resistant strains. Inappropriate antimicrobial selection also has the potential to increase the risk for resistant development. زي ما ذكرنا انه طوالي هي حتأثر لي الى شنو؟ تؤدي لي الى resistance اذا كان في مس يعني bad use of the شنو؟ antibiotics. Next, Erlene. Next slide.
This one.
Click next.
Antibiograms are also used to, this is the next. Hello, doctor. Okay, antibiograms are also used to check the causative agent. Belongs to a species capable of exhibiting resistance to commonly used antibiotics. Study the epidemiology of resistance. Evaluate the efficacy of new antibiotics. I'm waiting for Dora. Yes, Doctora, you lost. What happened to you? Anyway, you are coming back. I think the connection, that's this the one. Hello, Doctora. Hello. Continue, no problem, Doctor. You are now in the antibiograms are also used to, this is the slide, the last one, because maybe the connection.
Before
Yeah,
Erlene,
yeah.
before.
Yeah. This is the one. Antibiograms are also used to. This is the next.
Before
Yeah.
this. Before.
I will check the other one. This one.
Before, yes.
Yeah, this one.
Yes. Suspected in 2015, antimicrobial resistance will be the big problem and maybe lead to death more than the cancers and diabetic and accident. It is suspected in 2050 في 2050 متوقع انه الانتي مايكروبيال ريزيستنس يكون مقاوم. هي حتكون it is lead to this is the first one. متوقع انه في 2050 2050 it is for this reason it is a big problem and it is important to know how to avoid this to be not occur in 2050.
Yes.
Antibiograms are also used in check if the causative agent belongs to a species capable of exhibiting resistance to commonly used antibiotic.
Okay.
Study the epidemiological of resistance. Evaluates the efficacy of new antibiotics.
Antibiotics. Okay.
Yes,
next.
Also used for this. Yes, next.
Next, how to begin.
How to begin our work with antibiogram.
Yes.
لو أنا عايزة أبدأ الانتيبيوجرام، أول حاجة هعمل isolation عزل للبكتيريا. Identification. What is the types of bacteria? If it is Klebsiella, Proteus, Pseudomonas, E. coli, of the pathological microbe and antimicrobe of pathogenic agent are normally carried out when a bacterial disease has produced a problem. The bacteria that must be isolated must be pathogenic. Okay? To make the antibiogram, first make isolation and identification. We have specific and general method to identify the pathogenic bacterial isolate. Mechanism in testing the antibiotic. بعد ما عملنا العزل والايدنتيفيكيشن، عملنا تعرفنا على البكتيريا، then هنعمل basic idea of diffusion assay is as follow. The tested antibiotics are impregnated in paper disc. بنجيب البيبر ديسك فيها specific media. For example, Moral and Hinton use here in my lab, Moral and Hinton media. Put the disc in the media after put the bacteria or after culture this media, put the disc and incubate it 24 hours. After 24 hours, the picture appear like this. Then measure this zone. If the zone, next slide,
Mechanism.
Erlene.
Yes, mechanism in testing the
Following
antibiotics.
diffusion of the compound through the agar, halo or zone, this is the name zone. Measure this zone. Where a concentration of specific diffused antibiotic is sufficient to inhibit the microbial growth. If the zone large, this means this antibiotic can make inhibition to this microorganism which is cultured in this media. Okay? If there is a small zone, this means this antibiotic cannot be inhibit this bacteria. Okay?
Okay. Interpreting.
Interpretation. Next slide is yes.
Interpreting an antibiogram.
Yes, interpreting an antibiogram. The correct interpretation of the antibiogram will be of interest to microbiologists and laboratory technicians alike. This make interpretation how this antibiotic considered as sensitive, resistant, or intermediate. By measuring this zone by specific ruler. What is susceptible? This category implies that an infection due to this bacterium may be appropriately treated with the dosage of antibiotic recommended for that type of infection. إذا كان في clear zone خلاص وكانت large معناه هو sensitive the doctors can select this antibiotic to treat the infection. Okay, if intermediate, the doctor can be increase the dose more than the normal dose. If intermediate, can be increase the dose with this specific antibiotic. If resistance, no zone or very small zone around the disc, this means this antibiotic is resistant to this bacteria. Not use this antibiotic. If resistant, not use this antibiotic to the patient, or if the doctor start with this antibiotic must be stopped and replaced with another antibiotic sensitive or intermediate. Okay?
Okay.
How we express the result? Express the result, yes. In the lab, we measure this antibiotic zone by the ruler, but we this is more diffused method. So we use qualitative expression as sensitive, intermediate, or resistant. Okay, this is the more simple than measuring of the disc by millimeter or centimeter. Okay. This is antibiogram. This is the example of antibiogram. Erlene, next to
intermediate
to see the picture of antibiogram table.
The table, Dr.
Next slide.
This one. How we express the results.
Title antibiograms. For example, tested for Escherichia coli. Escherichia coli. What is the means? If the percentage in the antibiogram may be 58%. What is this means? Next slide, Erlene, to see the yes, to see the antibiogram table.
This one.
Yes, next.
Next is your document antibiograms with ONET.
After interpreting, yes. Erlin, are you hear me? طيب, continue. If the ciprofloxacin in the table of the antibiogram, for example, 58%, what is this means? What is this percentage that is put in the antibiogram table? What is this means? This means Escherichia coli from all isolated number, there is 55% sensitive to a ciprofloxacin, for example. Okay, another example maybe مثلا 70%, 70 or 46% for ampicillin. What is this means? This means 46% of all isolated Escherichia coli are sensitive to ampicillin. This is can be read how to read the antibiogram or how to interpret the percentage in the antibiogram. Also, this can be read for Klebsiella, Protea, Pseudomonas, Staph aureus, Enterococci. All types of bacteria can be represented in an antibiogram as percentage. This percentage means the percentage that put in the table. For example, 70% of Klebsiella are for all isolated. For example, we said periodically, annually. من كل اللي أنا انعزلتهم في السنة إذا كان 70%، 70% كانت النسبة مثلا بتاعة الأمبسلين، معناها 70% من كل اللي أنا عملت لهم ايزوليشن في السنة، كل العدد الموجود اللي عملت لهم في السنة. فور اكزامبل كان مثلا كيف 75 isolated، كان مثلا 90% كانوا sensitive للسفازولين، وكان 62% هم sensitive للأمبسلين. This can be read. 0, this means all are resistant, not sensitive. Okay, to ampicillin, for example. Erlin, I talk about the antibiogram. Discuss the result. Can you share the slide again?
How we express the results, it's already here.
Yes. Can you share the slide?
What number, Dr.? Because I lost.
No problem, no problem. I will see.
Now I come back.
In my computer, the slide
yes,
number 20.
Yes, I know you are continued, but
20.
me, I got
Yes.
disappeared. Now I come back
20.
again.
Yes.
Number 20. Yes.
Slide number 20.
I follow
yes.
you. I know.
Yes.
I already number
because
20.
it is very important
yeah,
point.
This one. Yeah, this one.
Interpretation of the result. Yes.
Yes.
Yes. This is the antibiogram. Okay.
Yeah.
For example, antibiotic tested Escherichia coli. Okay. This is the first. In the first one, Escherichia coli. Number of isolated 165. This means في السنة كلها أنا عملت isolation لإشريشيا كولاي بعدد 165 بكتيريا. أوكي؟ طيب 55% منها من ال 85% من ال 165 هم كانوا sensitive للسيبروفلاكسين. This means. Okay? I miss you again, Erlin. And this also يعني Escherichia coli Klebsiella, for example 0. 0, this means all of the isolated bacteria Klebsiella or are resistant to ampicillin, for example. Yes. Or isolated 75 here, 75 of bacteria are isolated in the مثلا in the ear. Okay? Or pneumonia. Klebsiella types, Klebsiella pneumonia, this means no of all this Klebsiella pneumoniae, all of these bacteria are resistant to the الأمبيسيلين. Okay,
Okay.
can
Number?
you yes, 20 in slide 20. Okay,
Yes.
can you share the screen again?
Yeah, it's already shared. Go ahead, Opara. It's already on the screen. Full.
Okay, the next slide about documentation antibiogram with
Yes.
honest. Yes,
Unit.
honest is هو برنامج بتاع سوفت وير. Some hospitals have adequate support from the computer department to be able to extract data from their reporting modules. The honest software can be freely downloaded and used
And
for
use
analysis.
for
عشان ممكن
analysis.
for analysis can be used software computer program called honest. Okay, next slide.
Okay. All the documented
Yes,
results.
next slide.
How to modernize.
Yes, all the documented results are analyzed in honest. Okay, Erlin, in the slide, not you are not click the next slide.
Well, I click na in
Yes,
the full screen.
appear to me the antibiogram picture 20.
Ah,
Yes,
20.
yes, click next
Wait.
one. Documentation is very important in any hospital. The heart of honest is a software package designed to collect the result of antibiotic resistant test. Researcher microbiologist feeds the result into computer and look for trends. يعني ممكن هو اللي يعمل فيد للداتا هو الميكروبيولوجيست or a researcher. Okay, how to modernize hospital antibiogram. Antibiogram must be printed or put up in the intranet for easy access to all clinicians. Like Sabahit folder who share, also antibiogram must be shared and printed and available to all, printed and available to all doctors. Antibiotic policy is one of the mandatory requirements for accreditation and making an antibiogram is the first step before framing the antibiotic policy. Last one, I want to talk about antibiograms, how to help for taking decision on empiric antibiotic. Antibiograms provide guidance for empiric antibiotic use in patient, but other factors, including patient characteristic and prevalence of other risk factors, should be incorporated when making therapeutic decision. يعني لما اخذ القرار بتاع التريتمنت لازم اخذ الانتيبيوجرام، لازم يكون موجود عندي عشان اشوف what is لانه نحن الانتيبيوجرام بنعمله لوكالي in the hospital، بعمله في المستشفى حقتي في المايكرو اورجانيزم ذات كان بي ايسوليتد، اتعزلت وين في اور هوسبيتال. عشان كده انا اول من اجي ادي الدراكس او اعمل الدكتورز make decision for therapeutic for the patient must be put the antibiogram inside in front of, then make the therapeutic decision. To know what is the types of the antibiotic that resist for Klebsiella or sensitive to Klebsiella, to see the antibiotics for which is resistant, which is sensitive. In the slide of future of antibiogram. Okay, Erlin. The future of
Num-
antibiogram would
yes,
be,
number 25.
yes, would be the incorporation of patient-related data to make information more reliable
Reliable.
and for أيوة predicting outbreak. In the future هيكون في المستقبل تقريبا الانتي بايوجرام هيكون برضو available ليه لازم يكون هو we're aware by the antibiogram. Mobile application on iPhone and iPad. Antibiogram helps hair care professionals. لما يكون في الموبايل خلاص هو بيكون لي متاح في أي وقت وفي أي مكان وفي أي زمان. And clinical microbiologists choose the most effective antibiotic to empirically treat infections based on local susceptibility pattern. Now, this valuable information can be available to them on iPhone, iPad, mobile devices. This is in the future. Maybe of care. Share the antibiogram to the patient to be the patient really this make reliable decision. Okay,
Decisions.
and yes, the
Yes.
patient make more confidence about our decision in the hospital. Okay, any question? Okay, thank you for your attention.
Thank you, Doctora. Even we are interrupted of the some conditions of our connections of the internet of our no. Now we finished already these slides. Is there anything to add more, or for your some staff of the laboratory? Do they have any question for it?
If there is any question about antibiogram,
Yes.
I will answer inshallah.
Okay, because we are already we already finished this year antibiogram, and I already informed Dr. Muhammad Hussein, our pharmacist, for this lecture discussion, and inshallah maybe if he had time he can come. Hello, Dafara. Thank you very much for the participation, for the discussion that it would help for the staff, the knowledge of about antibiogram. And is there anything in this question regarding for the staff? You are welcome for us. And since Dr. Already discussed antibiogram, we have here, I already do the memo the other day for the new checklist for restricted antimicrobial order. And we discussed and do this yesterday with Dr. Sana. Uh, And the part one of restricted antimicrobial order should have your to be completed by prescribing physician. And then send the form to the antimicrobial stewardship email to the physician once the physician and nurse sign it. And this include what we have only in the possibility. You must write it here. On the first box, the meropenem, I will mention it. Impenem, the fifth tassel, and the vancomycin. It was indicated here, infectious disease. Consult already. If requested, you will tick the box. If yes. If no, you must consider no. Then you must put the diagnosis. If it's example, if it's pneumonia, or in the skin and soft tissues infections, UTI, uh, meningitis, osteomyelitis, intraabdominal infections, septic shock. These are the sample of diagnosis that you will find in the restricted antimicrobial order, which included also the justification of restricted antimicrobial use, empiric, culture guided treatment. What do you mean by empiric? Empiric treatment means, example, if the patient taken already the antibiotics without yet the result investigation not yet come, and then you need to give the antibiotics. This is for empiric. Must have evidence-based uh, conditions, for example, for the patients. And then culture-guided treatment, of course, and then the source. Don't mention doctora, the organism, and sensitivities. And then the next box, the cultures and prior to antibiotics initiation, yes or no. This specified by specification for if it's blood culture, CSF, sputum, or wound culture, body fluid. And then the box prescriber contact the antimicrobial team, and then approval, verbal approval. If no approved alternatives recommended, person contacted. Prescriber did not contact the ASP team. Please contact team within 24 hours for non-ICU and 72 hours for ICU. And then it will be signatory of prescribing physician, name and signature, with mobile number and date and time, of course. Included the nurses, because this is a team. Then the doctor who makes order and the nurse also will assign with mobile number and date of time. And the part 2, it to be completed by antimicrobial stewardship team. The box you will tick or the approved antimicrobials, approved durations and conditions. Then non-approved antimicrobials. Then who will the next sign? Who will the next signatory is your consultant. Then name, signature, number, the date and time. On the last part, on the part 3, be completed by clinical pharmacist. The prescriber accepted ASB recommendations. On the next box, prescriber did not accept the ASB recommendation. And the third box will tick which one? Infectious team consulted to consult the infection team. And then the will sign for it, the signatory is the clinical pharmacist. In this form, I will give to each area. The concern for the antimicrobials program. A patient with a life-threatening conditions due to a suspected infection can receive from antimicrobial dose without waiting for the approval visit. Again, a patient with a life-threatening condition due to suspected infection can receive from antimicrobial dose without waiting for the approval. There is no, it's noted there. And then prepared by me, infection control prevention is reviewed by laboratory consultant and approved by the head of the pharmacy. Okay. Now, sorry for the interruption because some of our signal have already uh, to all my on the dashboard chat under my fatal way shout out Dubai or W under ventilator. And are you still there? Dean? Faith? Thank you, Faith. I will only check the I will only check who is to message. And thank you guys for this attending this lecture today. Was I did not appear, I think last maybe 3 weeks because I need to prepare my I did prepare my exam. And that's why now I can continue this. On the next topic, I have provided already anti- uh, antimicrobial prophylaxis. Because we need to have this prophylaxis. And then I will share to you some terminologies that I prefer for this. What is the meaning of antibiogram? I will tell you. Anyway, it's already in the my PowerPoint, so you can browse it and check it again, and then can by the way, this antimicrobial stewardship program must be updates to all my colleagues. I need your cooperation for this program. And on behalf of my team, Infection Control, we are here and open arms with you to be on this program. Let's need this be updated. Okay, and the chat, I have question. What is EDCA? The acronym is EDCA. This is my question for today. It's easy. The question is very easy. You can write your answer on the last board in the chapter. What is PDCA? Hi guys, I'm back. Sorry. For the discussion today, is finished already, but I want to just before we end, quick slides again with my background music. Just a review for it.